Connie, you lost your fiancé very early in the pandemic, and he had symptoms even before we went into lockdown.
Yeah.
What was that experience like?
Well, he started symptoms probably about the 21st of March, just like a cold, you know, and then it was 1 in the morning, the Sunday morning, and Jason Lakes was on TV and he said, if you have flu-like symptoms, it's not, you need to go and get checked because the flu season's over. So we went to the hospital, we phoned 111, they advised us to go to the hospital, and he was sent home again with antibiotics, said that he had COVID symptoms, however it may be a chest infection, and to take antibiotics and plenty of water and paracetamol.
And how long after that before he passed away?
From that day would have been 37 days.
Right.
After the first.
And it was just progressively getting worse the whole time, not getting better?
Yeah, no. So he was sent home from the hospital, and then 2 days later he collapsed in the toilet, and he was really struggling to breathe, and we phoned 111 again, and he was rushed to, well, I had to take him to A&E, where he was put on a ventilator that night, well, early hours in the morning, because his oxygen levels were so low. And he was in the hospital for 8 nights, and then he was transferred to get ECMO treatment, right, which he was then in
a specialist hospital? Yeah. Okay. So how important is this inquiry to you then? What are you hoping to see come out of it?
I want answers that I have, that, like, why was he sent home? Like, I may not get the answers, but I would like to know what was the reasoning behind why were they not taking people into hospital at that time. They said they were trying to keep the hospitals clear. Well, why, if people needed treatment, why not take them in? So for me, I want the answers, hopefully get the answers that why he wasn't treated when he should have been treated. Because to me, 2 days of oxygen may have helped him live. Okay. Plus, when he was transferred as well, he was on dexamethasone, and there was a communication breakdown, and when he went to the other hospital, they didn't continue with the dexamethasone, okay, which was then found to be actually helping people survive. So
and Maggie, we're hearing that's a very moving story from Connie and very personal to her, but of course it happened to so many other families, yourself included. So give us an idea what happened to you.
My mum died from hospital-acquired COVID in June 2020. Mum was in the shielding category, very vulnerable because she had lifelong asthma, severe COPD. She developed a chest infection, which was a repeat pattern, you know, in her later life, and she required hospital care. And she was only in hospital for 4 nights and 3 days, and in that time in 4 different clinical areas. She came home, but she never really picked up, and then it was very obvious that she had developed COVID. And subsequently, the health board have confirmed that there were 4 patients positive with COVID in a non-COVID ward, care of frail elderly ward, where my mum was.
You're representing the Scottish bereaved families. What's the feeling of that group now that the inquiry is underway?
I think we are. It's been a long time coming. It's felt like a long time coming. But today was really a landmark day for Scotland and for Scottish COVID bereaved, that the inquiry is finally in its proper hearing phase. And very much to do Lord Brailsford and Mr Gail KC to the inquiry set the tone about the impact to not only ourselves in Scottish COVID bereaved, but to every man, woman and child in Scotland, and they very much want to hear what that impact was.
Alec, you're a former health secretary, and you'll have heard of inquiries, been experiencing inquiries. What have you made of what happened today so far? It's early, I know, but
Well, I think it's got off to a good start today from what I've seen and what I've heard, particularly from Connie and Maggie. I think Lord Brailsford's a very straight shooter, and I think he will be fair, as he's promised to be. He'll be independent. He won't be bullied about by anybody, and I think he'll be very thorough. Being a judge, he relies entirely on evidence before he reaches any conclusions or recommendations. So I'm actually very optimistic in that sense that this will be a well-run inquiry, and I hope at the end of it we get serious answers to the serious questions that people are putting to the inquiry and have been asking now for 2 or 3 years.
And why do we need a Scottish one specifically rather than the UK one's been running for months?
Because there's a division of responsibility here. There were some things that the UK government was responsible for, and there were other things that the Scottish government was responsible for. So that, for example, the decision to lock down was entirely made in Scotland, but for obvious reasons it fell into line with what was agreed for the rest of the United Kingdom. So there were decisions made in London and there were decisions made in Edinburgh about lockdown. So I think it's fair to understand the dynamics and the reasons for those decisions both in London and in Edinburgh. This is not a blame game. I don't think anyone is in it to blame people. Everybody knew this was an unprecedented situation and everybody was learning as they were going along. But we've got to learn what mistakes were made and be honest about the mistakes that were made, because we want to make sure we never ever get into such a situation before again where we are so unprepared for such a major event.
And Connie, you were agreeing
Yeah.
with Alec there. It's not blame that you're talking about here.
No, it's when we first met Nicola Sturgeon, the families, she actually apologised for any mistakes she made. She says we're not perfect, we all make mistakes. I was asked, do we want an apology? No, I don't want an apology, because Nicola's already apologised to us personally as families. And what's an apology going to do? You know, it's not going to take away the pain that we've went through. We just want, you know, it's why did it take so long to lock down? Why did she make mistakes? What was the mistake she made? What should you have done? I mean, we're the ones that's sitting grieving. Like, well, I'm 3.5 years down the line yourself, and it's still happening. People are still dying to this day, you know. And we just want, what did you make? What could you have done, and what will you do in the future?
And Mike, is there maybe a sense of hindsight here that this was unprecedented living memory? So a lot of it is hindsight. It's easy to be wise after the event.
Yeah, of course, it's about looking back, and looking back is about learning, and so that we don't make the same mistake, the decision makers don't make the same mistakes again. My husband also died from COVID 6 months after my mum, and I believe we picked up COVID through asymptomatic transmission, which was something now that when we listen to the evidence from the UK inquiry, the scientists, the epidemiologists are telling us that was well known, that was a route of transmission way back in January 2020. But by December 20, we still weren't really listening to that. So for us, the inquiry is about accountability, which isn't about blame, that's about responsibility. Taking responsibility for the decisions that were made or not made, and learning things did go well, but where are those things? What happened that went well, and how can we learn so that we can make that happen consistently again in the future?
And Alec, do inquiries make a difference? Can Connie and Maggie perhaps get the answers they're looking for?
Yes, I think they can. There are some inquiries that don't make a difference, but I think this inquiry will make a difference. To a large extent, it depends, first of all, on the chair, and I'm absolutely sure that Lord Brailsford will be an excellent chair, but also about how the people who want to use the inquiry to get answers and how they go about doing that. And, you know, for a long time since the talk of this inquiry was started, people like Connie and Maggie have been very influential, along with their lawyers and advisors and their groups, about trying to influence how this inquiry is set up, what its remit was. And if you look at the remit, John, it's a very good remit. It has an aim which is basically to establish the facts of what happened, and secondly, to make recommendations on the future, basically to make sure the same doesn't happen again. But if you then look at the scope of the inquiry, it's a very broad scope. So there is basically nothing that I can see an area where people would want to ask questions and they won't get the answer, because the scope is wide enough to cover, I think, all the potential issues that need to be addressed. The one caution I would say, though, is we don't want this to go on for years. You know, Harold Wilson used to say about Royal Commissions, they take minutes and waste years. Well, we don't want to take minutes and waste years. People like Connie and Maggie need answers, and many thousands of people affected by COVID need answers sooner rather than later. And also the Scottish Government needs answers, because people like Bill Gates are predicting the next pandemic might be just round the corner. So we don't have 5 or 10 years to learn the lessons. We've got to learn these lessons pretty damn quickly, just in case another pandemic is round the corner and we're ready. We need to be ready the next time. That means we need to know what we need to do to be properly ready.
So what do you want ultimately to come out of this, Connie?
Well, I know you were saying about we want answers, but as families, we need closure. We don't have closure, you know, and that's what we just want closure on as best as we can.
And you would echo that, Maggie?
Absolutely, I want closure. I think we all want closure. And I want my family's lives, our family's lives, to have mattered.